A watched pot never boils. Isn't that what Grandma says? Didn't she always say, now if you watch what's going on, it's never going to happen? Or what about, if you bring an umbrella, it's not going to rain? Isn't that the truth? If you bring that umbrella, if you're prepared for the worst thing that could happen, then it won't happen. Right? That's what we're going to talk about today. Being prepared, looking for what's going to happen, and knowing what to do once you get to the point that you need help. I'm Dr. Megan, your Prednisone pharmacist, and today we're going to talk about what to watch for monitoring prednisone. So, the prednisone side effect series continues with monitoring prednisone. We're going to discuss the common side effects that we need to be watching for and specific things for each of those common side effects that we and especially working with our doctors need to check. And then we'll end with where to find more help with more answers. The number one complaint of people on prednisone is weight gain. And it's reported that 70% of people on prednisone experience weight gain. So we need to be watching for that. Obviously, the simplest thing that we need to be checking is weight. And that can be used along with the height to calculate a BMI or body mass index. And it's important to see what your weight was when you started prednisone compared to where you end up at high doses, and if it changes when you get to lower doses. And I've got a whole series of how to cope with the weight gain. So if you're wondering about what those are, check out the weight gain video series. Next, and to me the very most important one to be checking, is bones. So bones are so important that the doctors who prescribe prednisone the most, the rheumatologists who prescribe it for things like rheumatoid arthritis, they say that they are so concerned about it, they got together and created a guideline. And these are from that guideline of things they wish that people were checking, especially the doctors. And so when you start prednisone, they want to know how high you are. What is your height? How tall are you? And the reason they're checking that is because your spine can get compression fractures. And so you can actually lose height if your spine is collapsing on itself. And that's from the osteoporosis. So we want to make sure that your spine is in good health. And so height, and then asking about fractures. And now those spine fractures, you can't actually feel them usually. Occasionally you might have back pain, but sometimes it's totally undetectable, except they'll try doing an x-ray. You can see that's the second to last thing there. Or that often can't even catch these little tiny cracks that smash the spine together. And they often have to do an MRI. Especially of another type of bone complication called osteonecrosis. That's when there's joint bone death, especially of the hips. And when that happens, the x-rays often can't detect it either. And so they'll have to do an MRI of your hip or whatever other joint. But you usually can feel the osteonecrosis, where you might not be able to feel the osteoporosis. Then, it's important if you're on prednisone for longer than 3 months to get a bone mineral density test. And the most common one is called a DEXA scan. And using that, they can calculate a Z-score. And that just shows how dense your bones are compared to people who have healthy bones. Because then they can track, if you're on prednisone long term, if you are losing bone density. And if you are losing bone density, then they need to prescribe prescription medications for you to stop that bone loss, because we don't want you breaking a hip or breaking your wrist or any other bone, and especially not your spine. So it's important to check these things for good bone health. Next is your heart. So in other videos in the side effects series, I've talked a lot about heart complications. And so some of the things that we need to check include blood pressure and your lipids or your cholesterol. And there are lots of blood tests that your doctor can run. And then using that and some other information like your family history of heart disease, they can calculate what's called a Framingham risk score. And this can help decide whether you need certain things like aspirin or a statin drug for high cholesterol or high blood pressure medications. Diabetes. So this goes back to that weight gain. Often the weight gain is from the high glucose or hyperglycemia. But when hyperglycemia is out of control too long and the insulin isn't doing its job in the right way anymore, then it can turn into diabetes. And when it becomes frank diabetes, when it's so bad, there will be really, really strong urination, thirst, and weight loss. So it's like you can't drink enough water, you're always thirsty, and you're going to the bathroom all night long, just lots of urination, and weight loss. And that's a real big sign, because on prednisone, you're usually gaining weight. And if you're suddenly losing weight and you're thirsty and you're going to the bathroom all the time, you definitely need to get checked by your doctor to make sure that your blood glucose is in a stable range. So they can test that in your blood. They can do an A1C, which will check the last 3 months of how your blood glucose is. They can do a test to see how your insulin balance is, called a 2-hour oral glucose tolerance test. And that is what they often do for pregnant women to make sure that they're not getting gestational diabetes. And so this is a longer test than just like a little quick blood draw. It takes at least 2 hours. Next is eyes. I've talked about these complications in the past as well, but if you're on prednisone long term, you need an annual eye exam, period. You just need to be going to the eye doctor every year if you're on prednisone. And they'll know what to look for when you tell them that you're taking prednisone. There are classic things that they can be checking and looking for to make sure you're not having those complications. And especially if you have these things here, they will check your intraocular pressure if you have a personal or a family history of glaucoma, if you have diabetes, if you have rheumatoid arthritis or other connective tissue diseases, or high myopia. So these are important to even know that it's a possibility that prednisone isn't going to have complications on your vision. And so go to the eye doctor, get your eyes checked every year. Finally, if you want a list of what these things are that you need to get checked and what you can do aside from just getting checked to cope with those side effects, get your prednisone checklist. And you can find it at prednisonepharmacist.com. And if you already have one, let us know which of these checkups you've been getting done. Have you been getting your eye exam? Have you been getting your bone scan? Have you been getting your blood tested for your cholesterol or your sugar? Or how about your blood pressure? How's it doing? Which thing are you working on? We'd love to know. Let us know. Signing off as Dr. Megan, your prednisone pharmacist.